Hello everybody. Hopefully you can hear and see.
You're just really organized.
If you want Dr. Ferguson, I can recommend somebody to TV that you
Oh, I wonder, do you think if we, yeah, and maybe we just put them under here?
some more.
Just for now. Because we won't need that till after, and then.
This is Teresa.
Teresa is our VT. Should we start with Marvel? Yeah. He's ready to go. I wonder if it's okay, Shelly, if I move this a little bit?
Yep.
Do you want to put it over maybe there, right behind you, Robin? Sure. Come on, guys. Your brother.
So Marvel's gonna get his pre-exam to make sure that he is in tip-top shape to get his surgery.
Thank you. 9.04 kilos. 1.0.
Good job, buddy.
You just make it. You just passed the weight test. I don't know what kind of scale you have.
Well, he didn't have his breakfast, so.
Yeah, I guess. Oh, so he's been doing well, Sean?
He has been doing very well.
And I know he got a little food in his nose, but that's all better now?
Yep.
Good.
I haven't seen it happen since then.
Good boy. Very good. Oh, that is a tiny kitten mouth. So we're just feeling his lymph nodes and making sure he's nice and pink and he's hydrated. Making sure that he is a good surgical candidate. Very good candidate. Boy.
806 people are watching. I think last time it was probably like 2 or 3. We did this once before with the firefly kittens, if you remember. Some of you will remember. There's some good camera work.
Boy,
Good boy.
Good boy. I'm lucky, and then I've got to see these kittens before, so I have recently examined them, so I'm expecting no surprises. Good boy. And I did find 2 testicles on all of them the other day.
That is always good.
That is always one of my favorite things, that we don't have to go on a testicle hunt.
We'll give him some privacy.
There you go.
So I am trying to monitor the chat as much as possible, so if you guys have questions, you can ask them and we will try to answer. Dr. Ferguson said before that obviously the patient care is the top concern, so I will try not to bother her when she's
37.5. And he was about minus 76.
doing important cat
Respiration
things.
is normal. I'm just going to have a regrope. Good boy.
Yeah.
So smart, he has 2 testicles. Turn that way. There you go. Face the camera.
Get your last look at Marvy with his testicles. You can compare how he looks without them. He will probably be just as handsome.
Oh, yes. There we go. So what I'm about to give him in his little muscle, and he might do a little peep, but Teresa's very good at distraction, is I'm going to give him something to help him relax so that he's not stressed, because we never want to try to do surgery on a stressed animal. And also we're giving him something that has a preoperative pain medication, so that we need to use less anesthetic when we're neutering him, because we'll already be blocking some of those pain receptors, and it will also help just make him a little more calm. So the best way to give it to him is going to be a little bit in the muscle, so he might do a little tiny peep, but it is just the tiniest needle that is available, so we'll see how he does.
Oh, baby.
There you go. Done. Yeah. That was the hardest part of the whole thing.
He survived.
Mm-hmm.
He's very brave. Oh, he's so brave.
0.01.
There you go.
There you go.
Let's go put you in that
So now we're going to put him in a kennel where they have a litter box if they want to have another little pee or a poop before surgery. And then we have one for after surgery on the other side that's warming up with nice heated blankets in it. You want to do this?
Sorry.
Half of the people in the chat are weeping because of the squeak.
They're weeping. Nico's coming.
Oh, it's Nico's turn. So you should know that I did take his temperature last night, and he was not enthusiastic about it. So be prepared for a little resistance.
Teresa is a great cat whisperer. Oh, he's bigger.
Mm-hmm.
1.12 kilograms.
He's very solid.
Is that my Marby speaking? You see? Hello, Nico. Good morning. Good boy. Can you see? Is it true? Is it true? Good. Can I see? Say ah. Very good. You're so lovely. Can you trim your toes? So his color is good. His mucous membranes look good. His mouth looks good. So we always make sure their airway looks normal so that we don't have any surprises. His ears are good. Very good. Face your friend, Teresa. Mm-hmm.
Someone's asking what drugs you're giving them.
I used hydromorphone, which is an opioid narcotic, and I used a teeny bit of a tranquilizer called acepromazine.
Thank you.
It's one that we've probably used, we've used on hundreds of these pediatric kittens, spays, and neuters, and they do very, very well. And you have to, the veterinarians will choose drugs that work for them, and the combination with the other drugs that we use during the procedure. It just seems to work very well in our hands. It's about 160. His heart rate's about 160 beats a minute, which is actually very lovely. These kittens have been handled so much that they're actually not overly stressed, which is great. Lungs are good. Good boy. You feel your tummy, okay? You should use the litter box before. He has a giant bladder.
He wanted to make sure
you're so smart too. You
made
have
his weight.
both your testicles. Okay. Ooh, got some good scratches. There you go. You didn't even notice. It's just a magic.
You guys have now made me look bad.
Teresa can take all the credit. And I think doing it one person is a completely different situation than doing it with two.
Look at him. He's gazing at you adoringly.
Yes.
So someone is saying that they're surprised that we can neuter so young.
We can neuter very, very safely over, given if the patient is healthy otherwise at 8 weeks of age, and also at 1 kilogram, which is about 2 pounds. There's shorter surgical times and shorter recovery times. So you have to put the whole patient together and make sure that they are healthy, but absolutely.
Yep, and I've noticed doing the babies this young, the recovery time is so much easier. It's shorter and it's so much easier on them. And you'll see these guys will be running around, even though they're not supposed to, in a couple of hours after they're done.
With smaller. And get you ready for your peep, Nico? You ready for your peep? Peep. Oh, there's that peep. There it is. Okay. You did very well. Okay. Okay. Thank you. Awesome. Thank you. We'll put you away. We'll get your brother. Go. Good job, buddy.
Oh, do you want to get through?
Yes, please.
Now it's Henry's turn. This is what Marvy looks like when he's on drugs. He's very relaxed. You can see his third eyelid coming out a little bit.
Good morning, Henry. Oh, 1.09. He's in the middle. And no concerns with Henry at all?
Nope. Good. He's probably the least brave, the least excited to be here today.
I think Teresa will win him over.
I hope. I have high hopes.
Good boy. He probably has the least membranes on his eyes, hey?
Mm-hmm. His are pretty good.
Yeah. They're gorgeous. They're gorgeous.
Very.
It's nice to have a quick peek at the back of their eyes because you can actually see blood vessels back there and that things look normal. See? Ah. Very good. He's so cute. Okay. Peek in your ears. No potatoes.
Oh no, Nico is now experiencing loneliness. Buddy.
There we go. Face your friend Teresa. I'm just feeling also their lymph nodes as I'm going, because lymph nodes can be a sign that they're fighting any infection or disease. So as I go from head to toe, feeling the lymph nodes, listening to the heart and the lungs. And the trick is for the cat just to think that they're getting lots of pets. It's okay.
You guys will get to see the actual procedure. It won't be like up close, super close, because I'm going to stay out of their way, but you will get to see it. It's not like really bloody or anything like that, so you don't have to worry about it.
Good. His heart rate is 160, Robin.
Good job, buddy. These beautiful markings.
I know. He's quite magnificent. They're having their ear growth spurts too.
Oh no. Boy.
Good. Sounds lovely. Lungs are clear. So I'm just feeling his organs. I can feel, I have one finger. Feeling each kidney, they're in the right place, they're the right size and shape. Lymph nodes are good. I'll take your temperature.
Thanks, good boy.
Very nice.
Oh, such a good
Hi.
boy.
You want to cuddle?
Mm-hmm. Oh, so handsome. His little ear tufts.
I love that, yeah.
Prancy pony paw.
Pretty similar.
There you go. Hey, buddy. Almost done. I know. Come on.
I'm trying a little less than 0.01. Very good boy.
Good boy.
Go. Oh, I don't know. I think he was really quite brave.
You were.
Very brave. What a good boy.
Shake it off. Shake it off. There you go.
Good boy. So what we're going to do now is let them get their pre-med absorbed through their muscle, and it will take about 20 minutes. And then we'll start with Marvel, getting him ready for surgery.
Oh boy. Maybe we will go see. All right, we'll go take a little field trip and visit the boys.
Do you need help for yourself?
No, I got it. I just got my cords all tangled up.
Oh, you know I can help for you. You want?
Oh, the blue stool.
You want to take your computer?
Sure, that would be perfect.
And then just go for Shelly.
I don't need one.
And then there's a plug in. I just help you. I'll call you.
Oh, okay. Dr. Ferguson is full service. She fixes cords and she gets stools. Thank you. All right, that should be good. All right, that's perfect. Good. Now would be a good time if you guys have any questions, put them in the chat, and we'll see if we can get some.
I can also, if you want, put your computer there, just plug it in there.
Oh, that might be
Is that
good,
better?
because then I could, it'll be, yeah.
It's just noisy.
Hope you all took your seasick meds this morning. Thank you. All right.
Right.
meds make them wobbly?
Yes, likely. And sometimes it makes them vomit,
Oh, yeah.
which is sometimes something we want. If they still have food in their stomach, we'll bring the, if they have food in their stomach, it will empty their stomach prior to the procedure. And in one case with the tiny kittens, we had them vomit up that collar once, which was lovely, and it prevented a surgery.
Remember the Lynxtigator? Those of you who are jungle kitten veterans, and how excited we were that he vomited? That was the most celebrated vomit we've ever had. Hey, buddy. How's everybody doing? Nico, how are you doing? Marvy's drugs are kicking in. There's Nico. Hey, buddy. Oh, Nico. Good boy.
Yeah, maybe just.
Oh, hey, buddy. So every kitten kind of reacts a little bit differently to the meds. Sometimes they're playing and then they go to sleep. Sometimes they just hang out, like Marvy's just like chilling.
How are they
But
doing?
they're usually pretty happy once they get their meds. I think they're doing just fine. Henry's still a little nervous, but he just got his. See, Marvy's happy.
That's perfect. Because we want them nice and relaxed. They release less adrenaline, and it's actually a safer anesthesia to have a really relaxed kitty cat.
He looks pretty relaxed.
He looks very lovely. That's perfect.
Yeah.
Yeah. So we'll give him just a few more minutes to finger out. You're going to get our maximum effect. Wow.
Oh, buddy. So handsome. So we're just doing 3 today. Not just, like, 3 is a lot to do in one day. Oh, look at that handsome boy. Let's see. We'll give your brother a hug. Dr. Ferguson's extra nice because she puts feel away on their blankets and stuff so that it's a little less stressful for them. They do a very good job trying to minimize all of the possible things that might cause stress. Right, buddy? Nico's feeling pretty good.
Having them in together as litter mates when possible is
Yep.
really decreased stress also.
In case you didn't hear, she said having them in as litter mates helps to decrease stress also. Because they get to snuggle. And I always send them with things that smell like mom for extra added comfort. Let's see how Henry's doing. Oh, Henry. Oops. I always used to be very nervous when I dropped my cat off to get things done. That they would be sitting in a cage crying and stressed and worried, but as you can see, that is really not the case. Henry needs a hug, though. Hey, buddy. Big day for you. So they're getting everything prepped and ready down there. We'll be actually going into the surgery room, which is right there. And they have some great heated blankets and pads to keep them super comfortable. throughout the whole delightful experience. It's like a day at the spa. There's Henry. And everyone say thank you to John, excuse me, for being chief of PSAs today. Yes, that's all. I wonder how Patty's doing. If Patty's like this.
You know which ones? The only difference I'm doing is if it's a teeny bit acidified, then it might stay. Oh, like. Like that. Okay, so I'll straight across. Yeah, that's pretty much it. Just get a little less.
1,300 people watching. Oh. No pressure.
The power?
No pressure, I said.
Oh, no.
1,300 people. We are all very grateful to Dr. Ferguson and her excellent team, Robin and Teresa, who are willing to do this for us to help educate about spaying and neutering. As you can see, Henry's meds are starting to kick in.
Is he also? Good job, Henry.
Yes. Oh, yes. So big hail for Dr. Ferguson, Robin, and Teresa. And you guys can feel free to ask questions, and we'll try to get as many answered as possible. It just will have to be, we're not going to distract Dr. Ferguson with questions at a critical moment, but we do want to answer all of your burning spay-neuter questions. Who's stuck? Is someone stuck? Here's the whole team. The whole team.
Warm it up.
They're all feeling pretty good.
Wrap it, and then it can be the pressure to help it. How long do you
Oh, I hear purring. Someone's purring.
Oh, it's a kitten. It's a bundle of sedate kittens.
A kitten bouquet.
Happy kittens. You had a question?
Sorry. I'm struggling. I don't.
It was good.
I think I said they can ask questions, but I haven't seen. Oh, are they put to sleep? They're asking.
Yes, they are.
So, yeah, they'll be.
They'll be completely under general anesthesia, and probably just as important as sort of so that they're comfortable for the neuter is that they're comfortable for the tattoo, because they're going to get tattooed, which is important, and we can talk more as we're doing the tattoo for their identification. That'll show that they're spayed and neutered, and then if they ever happen to sneak out, they'll be able to find their way home. And tattoos are not super comfortable, so I do not do it while they're awake.
That is good.
So the tattoo probably takes as long as the surgery, to be honest.
Oh. Dorothy is scheduled for next week for Spain. She is very amorous. So for those of you that don't know, Dorothy has been in heat for probably a week, well, probably 2 weeks now. And so she could be pregnant again had she not been rescued, if you can imagine. So she's been very, very affectionate. So in Canada, it's much more common to tattoo than to microchip. We do microchip if they're getting adopted into the States because it's more of a common practice there. But the point of the tattoo is to have an easy way for people to know that this is an owned cat that's been neutered or spayed, and also to trace them back to their owners. So
we encourage owners, if they can, to do both, actually. Microchips are much more international. The microchips that we have, they can even read in Europe and Australia and all over the world, so they're very international, and that's very lovely. And it's a way of also getting hold of the owners when the clinic is closed and keeping track of the tattoo records. So that can be very awesome. But if people have to only choose one form of ID, we sort of go over what is the best choice for them. But shelter animals, it's the standard to do a tattoo in the right ear, always the right ear. And then we know that the animals have been altered, because sometimes we can't tell later on if a cat's been spayed or not. But if it has a Shelter Humane Society tattoo in the right ear, we don't have a question. We know that it absolutely has been spayed. And boys don't always descend their testicles, so then we absolutely know that they have been neutered also. And then also a way of tracking it's the parents, or the owners. Sorry, not the parents.
We call them parents. They do it in the ear because that's just because it's an easily visible area.
Not a lot of hair. Because if we shaved and tattooed any other part of the body, the hair would grow back. Some breeders tattoo of dogs, it's going a little bit less common now. They tattoo the inside of the belly on their dogs. That's called a breeder tattoo, and they're registered with the American Kennel Club or the Canadian Kennel Club. But even more commonly, I think now, is they're using international microchips because of people traveling. And tattoos, to some degree, they will fade over time. But I'm very lucky in that Teresa and Robin are very, very good at tattoos. We often get compliments on how good they are at them. We'll probably almost start on Marvel pretty soon, hey?
Yeah, he's feeling
I'm
pretty
just
good.
about to have a big snoozeroo.
I don't know if you guys can see, but Nico. Ooh, sorry, now I scared everybody. Nico was making biscuits. He was doing mini prancy pony paws, making some biscuits. And then I woke everybody up.
That comes procedure check. We'll give you a bottle of your favorite. Not your favorite ones, that probably can't afford that. But I did call them all. Okay. Oh, she has her picture. Okay. I didn't try calling her last name.
Look, biscuits. Nico biscuits. Slow motion Nico biscuits.
Should I steal a marble?
Yep. Okay, everybody. It's time. Sorry, Marvy's on the bottom. He's the pillow. Oh, buddy. All right, here he goes. There we go. Wrap these guys back up.
I like this trick actually from Veronica in the morning.
Oh,
Just having the sub-Q fluid sit in the
that is smart. So what they're doing now is they're going to get him connected to the gas, I think. Go a little bit closer. Sorry, everybody. So they're just checking his heart and seeing how he's doing on the pre-meds, making sure he's ready to go.
He's doing great. He's doing very good.
Getting a little massage. Very great. So we're just going to shave some of his fur, some of his floof. Look how brave he is. Look how handsome. And is this the anesthesia?
This is what's called the induction. It's spelled self-passive. It's going to safely put him under general anesthesia so that I can give him the gas.
You can see he's pretty relaxed. He's doing very well. It's hard to find. Very handsome.
I'm gonna have to shave you a teeny bit more, Milky. I always try not to shave first. But if we have to, we have to. No cat shows this week. Good boy. It's nice stripes under there.
I know. Look at this fancy stripy leg.
I think it makes an optical confusion. I know. That's so weird. Can you try just a different?
Super
Maybe just even with your finger
Yep.
like that. I think I see it then. You might try even just a different. He might have a better vein and a different. Like I don't want to poke him in necessarily. Like if I'm not gonna need it. Good boy. Seems to sort of be there, right? Or maybe not. Maybe
Let's
it's
check on the other boys while they're working on that. Oh, Henry and Nico. They're doing pretty well. Let's see. Hey, boys. You can tell they're feeling pretty relaxed. Henry has a classic drug face. His third eyelid coming up like that. Hey, buddy. Hey, buddy. Hey, Nico. Should we go see what your brothers do? Let's go check in with Margaret. Gonna untangle my cord for a second. Good. All right. Here we go. All right. all we've missed is got the they've got him intubated, hooked up to the gas machine.
Stupid.
They're putting a little ointment in his eyes to keep him from drying out. So we'll be going into this room here. Very comfy. So they have this nifty rolling gas machine. I'm sure that's the technical word for it.
Anesthetic machine.
Anesthetic machine that they will be rolling with Marvy with his adorable little mask on into the surgery room. I'll try to give you one little close-up before we get in there. You can see him with his little mask on.
Yeah, and we'll watch him. And I will prep him. Teresa can monitor him.
You can see they monitor every step of the way to make sure that heart rate's good and he's breathing and all of that stuff. So he should be completely under at this point. And they're going to now shave the area and clean it and get it all prepped so that it can be sterile.
He's doing great. Gonna make a noise with the vacuum. Okay. Yeah, right now. Plugged in.
Oh, so he's getting his ear tattoo right now. That's very exciting. Robin is doing that.
This is a warm water bottle that we're using just in addition, and it also helps keep his tail out of his incisions.
Ah.
So it's warming him and keeping his tail out of our business.
That's good. His tail likes to get in the business. There's his little face with his little mask and his new tattoo.
And I'm just giving him some subcutaneous fluids to keep him hydrated.
He's not going to drink as much today, so you're good. I will give you this.
Thank you.
I'm going to go get tea.
There he is, little patient. Doing great so far. Rockstar. Oh, he's getting a little lotion on his ear. That is a beautiful tattoo. Do you want one, Shelley? Yes. So, he's got his ear tattoo so he can be identified if he ever gets out, which he hopefully will never get out. There's his bum, all prepped and ready to go. And Teresa's just checking his heart rate, make sure he's still doing great. Having a nice little nap.
There we go.
And Dr. Ferguson is prepping the exam room, the surgery room.
She's actually scrubbed back here. I might just do another one, out here, and then you can do one more in there.
Turn your toes.
One more in there, little fella. Sharon has just entered the room to administer snuggles to the other two.
One more, my little friend, and then we'll do that final prep in there.
Robin's making sure he's all clean and disinfected. Oh, and they're giving him a pedicure so that he will wake up with fancy nails.
One more surgical prep too, and surgery too.
See what a good boy he is about getting nail trims.
So when we're ready to go, just leave the last one.
So one more listen, and then we can.
Good?
Oh,
All right.
You okay if we bring him in, Dr. Ferguson?
Yes. Thank you. Pass you the water bottle, Robin.
You got it. Our little man is going in. Oh, there he goes.
He's doing with us.
Okay, just 1 second. I'm gonna get the stool set up.
Who wrapped this? So when you're doing any types of surgery, and especially when you're doing pediatrics, one of the most important things is you keep these guys nice and warm and don't let them get hypothermic. Is he wrapped it?
you gotta do one more prep.
You just have this.
Oh, you gotta go there. Oh.
We just have to hold it down while there's
So to everyone who is just tuning in, this is Dr. Ferguson and Robin and Teresa from Mountain View Vet Hospital in Langley, British Columbia. And this is a rescue kitten named Marvel. And he's getting his neuter. And you can learn more about Marvel at tinykittens.com.
Okay. So making my first incision over the scrotum, and I'm excising the tunic where the testicle is held. Now I'm going to tie it off. breaths. We get his nails done, or Shelly got his tours done. Yeah. Usually we don't.
Shelly had them pretty
I
short.
was gonna say usually we don't have to do nails on Shelly's kittens because she does them already. I'm just cutting off the testicle.
You're good, but I might just
The
make sure
testicle.
nice one white.
First
Yeah.
testicle.
First one, we're halfway done.
Halfway done.
I'll put it on there.
Oh, there you go, guys. There's Marvel's testicle.
I'm gonna go get the second one.
Get the blue. There you go. If you've ever wanted to see a testicle, there it is. That's what causes all this cat overpopulation, that little tiny testicle.
So what he's got underneath is he's got an air blower. It's called a convection heater or a bear hugger. And it's a really nice thing that surrounds him by nice puffy air to keep him nice and warm while he's sleeping. Because they can drop their temperature quite quickly.
Doing great.
Go number 2.
There's number 2. Number 2 was a little smaller than number 1.
It was a little bit harder to get to actually, just a teeny bit.
So you can see no blood.
That's it. And that's the thing about also doing pediatrics is there is less blood loss because the reproductive organs are smaller. The surgery time is shorter. And one of the things with surgery is infection rate goes up exponentially with surgical time. So the shorter the surgical time, the less chance of infection also.
Oh, that's great.
So we'll just leave him on oxygen. He's just on oxygen now.
Robin's got a nice warm blanket.
Oh,
I'll get a few from Robbie. He probably doesn't need it. Maybe because no, I don't put any sutures. There's a couple different techniques for neutering. This is the one that I like the best and I'm the most comfortable with.
And it's worked out quite well for all of my kittens that you've done this. Let's see. So that is pretty amazing. Are you guys shocked at how fast that was? And no blood? Clean and fast. And he's doing very well.
Should I put this in the other?
That's a clean one.
Yes. And that's a new one over there as well. To wrap around. I've got one on and I've got more in the dryer. Okay. Oh, you did? Yes.
You're doing a good job navigating the cords I made for you.
He's doing well. You're just starting to pull back your feet a bit.
And do you use glue to close the incisions?
I don't. You leave it open. The reason is that probably in a day it will close on itself. And cat neuters are not completely sterile. I mean, we do them sterilely, but leaving it open in case anything needs to drain out. But they actually will just heal on themselves with that little tiny incision within a day. Like you won't be able to even tell where the incision is. So no glue, no sutures. There are different types of techniques, but I would say the technique that I use is what I see other vets that I've worked with over the years also do, with very little complications.
Someone's asking, do they give more pain meds after?
We do. Robin already has them drawn up. The pre-medication, the medication that I gave him in the muscle before lasts for probably at least 4 hours, maybe 6. So we were going to see how they responded to their pre-medication. He doesn't need any additional pain medication at the moment. He's pretty happy. So we'll send it with Shelley to give, just probably transmucosally, if she's not here in about 4 hours. So usually we give it because we have it, but Shelley is a super foster mom, so she will probably take these guys a little earlier than most, and then she can do the pain medication herself. But we'll see how it goes. We have it already ready, though, in case we need it.
Nathan's snuggle warm. He's too warm.
Mm-hmm.
He's too nice and warm.
So I got oxygen. I have a warm, puffy air bed.
Oh, there
You know,
we
the
go.
air bed, do they make those for people?
This actually is a human air bed.
Oh, really?
It is. It's something when I opened the hospital that I really wanted and that I've never had before.
Oh.
And this is what they would treat people with that have hypothermia and those kinds of things. So it's very lovely, and I'm
That's nice.
happy we have it.
They get the star treatment here, so he's gonna start waking up soon. He's starting to wake
He's
up.
already starting.
Oh, he forgot to put his tongue away.
Grab one more towel.
He had IQ right too.
He did. Oh,
Sometimes when they start coming out of the anesthesia, they react differently. So sometimes they'll be a little disoriented or squirmy or meow or forget to put their tongue away.
He just doesn't care. He's so happy he doesn't care that his tongue is sticking out. And he has, you might see that his eyes look a little goopy because part of you might have not missed that what Teresa did is they put eye lubrication in so that if they don't, because they're not going to be thinking and blinking properly, so that their eyes don't get dry. So if his eyes look a little goopy, it's because he has a whole bunch of artificial tears in there in addition.
Oh, he's doing so well. He looks so handsome without his testicles.
Yes, he does.
and your new tattoo.
And his new tattoo.
Do you want to see it?
Yeah.
Here's another one. I'm going to sneak to the back for a quick moment.
It's warm enough when you
Oh,
there, my friends.
look at his little, this is his little neuter face. Oh, there's our boy.
And see if you can get in on that tattoo there.
Yep, there's his tattoo. Sometimes they get a little smudgy from the cream, but actually it's pretty good. That looks very nice. That's some good work from Robin.
Oh boy. There you go.
Oh, are you waking up?
Mm-hmm.
Oh,
Oh, hello.
excuse me.
There you go.
Oh, tongue.
Yeah, are you gonna put that tongue in?
Somebody asked if he has a cut palate, and he does not have a cut palate. He has a cleft lip and he has a cleft nose, but he does not have a cleft palate, which is very lovely.
Yes, we're very relieved.
Because we would have probably had to, depending on the severity, arrange for maybe a veterinary dentist surgeon to fix that for us. But it is not necessary. And also at the moment, his teeth, even though he has his cleft lip and palate, are not causing him any problems. And hopefully it just continues like that.
That would be nice. But he'll have to be monitored a little extra closely till his adult teeth come in, right?
Yeah, exactly. To make sure that his teeth don't come in and cause any other abnormal pressure on his gums or anything like that.
Oh,
Stretches.
hey, buddy. Did you have a nice nap? Did you have such a good nap?
Yeah. Hi.
Everyone at Labs wanted to adopt him
Yes.
for obvious reasons.
Good boy. There you go. You're all nice and toasty.
We should give him to a kitten hugger, or how do you want to proceed?
I will take him,
You want to be
He's
the kitten
pretty
hugger?
comfortable.
but I will have to probably
Do you
hand
want to
him
maybe
off.
sit right here with him? And then
Oh yeah, that'd be good.
You can get situated and then I can pass you your baby.
Okay, that's a good idea.
sorry about the cord.
And then you're gonna get Nico ready to go.
Mm-hmm.
Or do you want us to maybe sit right there?
Yeah, this is good.
I'll bring you this.
Oh, thanks.
Like this, or you got it. So Shelly's gonna sit and watch us and cuddle Marvel.
Oh, he's so handsome and talented. Oh, what a good boy. So 1 down, 2 to go. Oh, what a big boy. Hey, buddy. Good job. So if you had any reservations about neutering, you can see he was pretty comfortable the whole time. Fast and easy. We got lots of snuggles. Oh, is that a big stretch? Big stretch.
Snuggled and needed.
So I think Nico's up next. They will not need cones unless they are excessively licking back there. I don't think I've had any kittens spayed or neutered by Dr. Ferguson that have needed cones.
We don't need them very often. It's not very common. Do we use cones? Do they need cones?
Nico! Hey, buddy! Did you hear your brother? Did you hear your brother? Here he is. He's so handsome.
Still needy.
Making bread.
He's making biscuits over there.
He is on the bed.
Oh, he likes his little meds that he got.
He said, "This situation is fabulous."
Oh, more pets.
This is
Nico. I think I may have
sorry.
missed.
I meant I was asking
Oh.
if they drew up the drugs for me. It wasn't. I knew
Yeah.
who the patient was.
You do know who Nico is.
I do know who Nico is. It was if this was his Alfax.
Look, I think I missed some of his nails, or maybe all of them.
We have the technology.
I know. Some of them look like they're a little sharp.
So we'll do the same time, guys? I'm gonna just steal this so the oxygen is at our disposal.
Yeah,
You
that
can
sounds.
still fade away. That's okay.
Attaboy.
Put that away from your head so it doesn't stimulate you.
Sort of put away. Light, pretty good, isn't it, type friend?
I'm gonna have better, actually. Running your eyes.
He's got Dorothy Prancy Pony paws for sure.
So happy. Look at the tall and feel pretty darn good. Boy. Boy, you're so brave. Well done.
He doesn't have the hiding tabby, leggy veins that his brother does. But I just checked their jaw tone to see how awake he is. He says, I'm still a teeny bit awake. So I'm giving him a teeny bit more. Oh, I can still swallow.
Twitchy, pinches. Much more, give it a go.
Hey, buddy.
He's gonna have a nice nap.
Story for the way.
Want to see how Marvy's doing? Here's a little Marvy close up. Hey, buddy. Marvy's doing great. Oh, what a good boy. Alright, so he's all hooked up and
160. So he's doing great. His heart rate's the same as when he was awake, and that's exactly what we like. That means physiologically he's doing very well.
so Robin's gonna do the tattoo. There's the tattoo gun. Or I don't know what you call it, tattoo
It's after you got it.
device.
No, you got it.
While Dr. Ferguson cleans and shaves the area. I'm gonna put this down.
Good and noise, so just beware with Marvel. What the night?
Someone goes there. The one. Oh, please.
Oh, okay.